Good morning. My name is Chris Stanley. I'm a paramedic with the City of Topeka and Fire Department and with American Medical Response. I've worked with the City of Topeka for the past 19 years as a lieutenant paramedic, and I've worked with American Medical Response, which is a privately owned ambulance service, for the past 25 years. Today I'd like to discuss a topic that is not only very important to me, but is something that we deal with each and every day on emergency responders. This is a topic that involves airway management. During every event, humans either experience cardiac or respiratory difficulties that cause their bodies to shut down, which is not prevented early enough can cause respiratory or cardiac arrest. During these events, the number one thing that blocks the airway is the human tongue. The body and muscles become flaccid, causing the tongue to fall back in the back of the airway, blocking the chance of oxygen exchange. This is our opportunity as firefighters, emergency technicians, and paramedics to act quickly to prevent damage to the patient's brain and major organs. We can provide many treatments in the field during these events, but for the sake of time, we will only discuss the basic airway maneuvers and adjuncts this morning. Upon arrival, emergency responders should quickly perform a primary assessment to determine if the patient is unresponsive, pulseless, and apneic. And what that involves is coming up, "Hey, can you hear me, Johnny? Johnny, can you hear me?" Quick assessment, no pulse. That means they're pulseless, apneic, not breathing. We're not seeing any chest rise. At that point, we'd begin CPR and start doing airway maneuvers. CPR should be started immediately in these cases, along with the following airway maneuvers: the head tilt chin lift. This is going to be something that we're going to come in here and we're going to open all we're going to do is just quickly open their airway, just like this. It's pulling the tongue to the back, off the back of the airway, to lift that tongue up to allow oxygen exchange. If we expect any type of trauma to the head and neck, where they've fallen down the stairs or anything like that, we're going to come in, we're going to grab the back of the mandible, the top of the jaw, and we're going to lift slightly forward and keep their airway in line and their neck in line, and we're going to lift the jaw forward. That's going to do the same principle, lift the airway up and allow air exchange while we are doing CPR. Another adjunct that we can use is called an oral airway. What we can use here, these are really simple. You measure these from the corner of the mouth to the tip of the ear. You bring these in, you measure it real quick, you grab the jaw, and these go straight in. Then we would bring in oxygen and a bag valve mask, put that on, and begin oxygenating with 100% oxygen at 15 liters per minute. Another airway adjunct that we can utilize is what's called an eye gel. This eye gel, we can use this really quickly. These are good adjuncts. Any basic EMT or EMTI or paramedic can utilize these. What we do is we put a little jelly on here. We rub it in here to make a good seal. We're going to grab their airway and we're going to insert this straight into their mouth. Now most patients, you got to remember, their bodies are completely flaccid, which means all their muscles relax, and these go in real simple. So that's going to go in there like that. We're going to put capnography on the end of it. We are going to tape this around their mouth here, and it's going to go underneath their neck, tape it back around, and that there is a secured airway. What we will use typically on males is a size 5. Females will use a size 3 or 4. Once this is placed, we would keep that in place, and the paramedic should not pull that once it's in place. The number one airway that most paramedics like to utilize is intubation. We're not going to discuss that today, but we're just going to keep with these basic airway maneuvers. After demonstrating each piece of equipment, I'm confident with the continued hands-on skills labs, each of you will become more confident with utilization of these pieces of equipment during emergency operations. Thank you for your time and have a wonderful day.